Are there rare types of stroke besides ischemic and hemorrhagic? When we think about strokes, the first types that come to mind are ischemic and hemorrhagic. Ischemic strokes happen due to blockages in blood vessels, while hemorrhagic strokes involve bleeding in or around the brain. These two types are indeed the most common, but there are also rare types of strokes that are important to know about. To understand these rare types, we can look at how strokes are classified in the medical field. The TOAST classification helps categorize strokes into ischemic, hemorrhagic, and cryptogenic. Cryptogenic strokes are those where the cause remains unknown after thorough investigation. There's also a term called embolic stroke of undetermined source, which falls under cryptogenic strokes. In these cases, a blockage is suspected to be caused by an embolus, but its source is unclear. Now, let's explore some rare types of strokes that exist beyond the usual classifications. One example is venous stroke, also known as cerebral venous sinus thrombosis. This occurs when a blood clot forms in the veins that drain blood from the brain, leading to increased pressure and potential bleeding. While not as common as arterial strokes, venous strokes can be significant, especially in younger adults or those with specific risk factors like clotting disorders or infections. Another rare type is carotid or vertebral artery dissection. This happens when there is a tear in the lining of a major artery supplying blood to the brain. This can occur due to trauma or sometimes spontaneously. When blood enters the wall of the artery, it can form a clot that blocks blood flow or sends clots downstream, resulting in a stroke. Though this is technically a cause of ischemic stroke, it is often discussed separately due to its unique characteristics. Additionally, there are other rare causes of strokes, such as vasculitis, which is the inflammation of blood vessels, genetic disorders affecting blood vessels, and certain metabolic conditions. While these are not separate types of strokes, they representing in common underlying causes that can lead to either ischemic or hemorrhagic strokes. Understanding these rare types can be crucial for early diagnosis and treatment. Medical professionals often use advanced imaging and laboratory tests to identify these less common presentations. This helps in guiding specific treatments and improving patient outcomes. While it is essential to recognize these rare types, it is important to remember that the vast majority of strokes are still ischemic or hemorrhagic. If someone experiences symptoms like sudden weakness, difficulty speaking, or changes in vision, seeking immediate medical attention is critical. Early treatment can significantly affect recovery. In conclusion, while ischemic and hemorrhagic strokes are the most prevalent, there are indeed rare types and causes of strokes, such as venous stroke and artery dissection. These requiring specialized attention and management. Always consult a healthcare provider for personalized advice and treatment.